guys, this is the alcohol episode. How many of you all out there are drinking too much? I'm not saying you're passing out drunk every night, blacked out, or that you're on the street panhandling for your next pint of vodka, but you know that you're drinking too much. Is it a leftover bad habit from college? Do you feel some kind of cultural obligation like, oh, I'm Irish, so I've got to drink whiskey? Or are you telling yourself that you're self-medicating and masking another mental health problem, like, I can only get to sleep if I drink alcohol, or it's treating my anxiety? Whatever the reason might be, before we get into it, let's talk about what alcohol is doing to your body. Everyone knows that if you drink too much, you're likely going to gain weight. But what most people don't know is that it's not actually the caloric content, the number of calories in a drink, that's causing most of the weight gain. Of course, if you're slamming double IPAs every day, you're going to gain more weight than if you're drinking skinny margaritas. But ultimately, it's the effect that alcohol has on your liver that's causing you to gain weight. The reason is because your liver is responsible for breaking down stored energy into usable energy, and it's also responsible for metabolizing fats. So if it's got a bunch of alcohol running through it, it can't do its proper job, because it views alcohol as a toxin, so it's got to get rid of the alcohol first before it can do those other things, so you just store the weight and pack on the pounds. Now, if you're drinking chronically, this isn't just going to happen when you're actually consuming beverages. Your liver will become scarred and just generally less efficient in processing fats, processing energy, and maintaining your healthy weight. So if you're gaining weight, you might also notice that it's not actually distributed on your body exactly how you might like. Everyone knows about the beer gut, but you may also notice your breasts getting a little bit bigger and actually your testicles getting a little bit smaller. This is because the effect that alcohol has on testosterone. It actually induces the conversion of testosterone to estrogen, essentially feminizing your body. You're also going to get an increase of the stress hormone cortisol. When cortisol goes up, you're going to have other health problems like high blood pressure and an increased risk of diabetes, but it also will block the production of testosterone. So how's your sleep when you drink? Those of you who are telling yourself that you can't fall asleep without a few drinks, are you sleeping throughout the night and waking up well rested the next day? Or is your sleep fragmented and you're waking up without any energy, fatigued, and probably in a bad mood? Or even worse, are you waking up completely in the middle of the night at 2 or 3 o'clock in the morning with anxiety and in a little bit of a panic, and have even thought or actually gone down to the kitchen to get a couple more drinks in order to fall back to sleep? This is because of the effect that alcohol has on the neurotransmitter GABA. Neurotransmitters are the chemicals that your brain uses to communicate with itself and the rest of your body, and GABA, which stands for gamma-aminobutyric acid, is the one that it uses to tell your body and your mind to relax. But if you drink too much, then the brain stops telling itself to produce the GABA. It's relying on the alcohol to tell it to do that. So if you drink a lot and you fall asleep with all this GABA that the alcohol has caused your brain to produce, then in the middle of the night, when your liver's metabolized all that alcohol, it's no longer telling your brain to release GABA, so you have none, and you wake up in an absolute panic with anxiety and stress and don't feel good. Also, GABA, too much of it, has an impact on your memory. It will actually impair your ability to form short-term memory, which is why if you drink a lot and you have way too much GABA, then you're going to essentially go into a blackout and not remember what you did the night before. So why do people drink too much? Well, some people truly are masking mental health problems. They have an anxiety disorder, so they drink, so they feel less anxious. They have a sleep disorder, so they drink to try and just pass out. They have PTSD, and they drink to, again, pass out or black out to make the nightmares go away. Or they're depressed, and they drink alcohol to feel a little bit better. Whatever the reason why you might be abusing alcohol, it probably has already come to your attention, and you realize that the temporary benefit of drinking doesn't outweigh the long-term costs on your body and on your mind. Why should you stop? Well, at some point, everyone who's recognized that they're drinking too much has probably had that conversation with themselves. Do I choose alcohol or do I choose the rest of my life? If you have a lot in your life to live for, you're happy with your home, you're happy with your relationship, with your kids, with your job, and you have less stress because of that, then you have more what we call protective factors keeping you from drinking. You've got more good reasons to stay sober and not screw up your life with alcohol. These protective factors are important. And I saw this in the ICU one day where I was consulted to see a guy who had been admitted after he'd been found, coincidentally, by his daughter, passed out in his car, which was in the garage, with the garage door closed, and his car engine was running. Turns out the guy, he was in his mid to late 50s, was a successful entrepreneur, had his own business with about 80 employees, had a beautiful house in a beautiful neighborhood, and unfortunately had some problems, though, in his personal life. He had recently been divorced, and he didn't really want the divorce, and his kids were kind of blaming him for the reason for the divorce. So he started managing this extra stress and this depression, this anxiety that he was experiencing by drinking too much. He was drinking first at night, most days, then every day, then during the day, then at work, until one day he was at home and he was drinking, but he ran out of liquor. So he got in his car with the intention of going to buy more, but unfortunately passed out at the wheel after he'd turned the engine on, hadn't opened the garage door, and should have died from CO poisoning had his daughter not happened to come over to his house to pick up a few things and found him there. So again, looked like a suicide attempt, but I honestly think it was an accident, an unfortunate one that almost killed him because he was drunk. But guys, this isn't unusual. People accidentally hurt themselves and look stupid doing it all the time when they're drunk. They also accidentally or intentionally do things to other people or damage property, again, while they're drunk, but they feel really bad about it the next day. So if you recognize that maybe you're going down this road, or maybe you've already had some of these experiences, what are some of the treatment options? Well, most of the options really are geared towards absolute sobriety. And if the phrase, "a drink is too many and 1,000 drinks is never enough," resonates with you, then maybe you're one of those people who truly just needs to not drink. If so, for instance, Alcoholics Anonymous is a great place to start. It's geared towards absolute sobriety, and you'll celebrate every single day, week, month, and year that you stay sober with good support from your home group and hopefully your sponsor to help you through the times that you inevitably are expected to relapse. Rehab programs can also be helpful, where you get removed from your life for a month or 2 or 3, and just being in a contained environment without alcohol and remembering what it's like to not drink for a while can be helpful. But you do need to stop working for that period of time. You're outside of your home in a contained environment. They can be expensive, and you need to continue the treatment after you leave the rehab program. Unfortunately, I can't tell you how many patients I've treated who have been to rehab programs, but on the day they were discharged from the program, didn't even make it home before they were pulling up to a liquor store. There's also medications that can be helpful. Naltrexone, which is actually an opiate blocker used primarily to help people with opiate abuse, can also help reduce the craving to drink alcohol. Many people find this effective, but ultimately you can still drink while you're using the medicine. So then there's also my favorite medicine. It's called Antabuse. It's been around for a long time, and essentially what happens is if you drink, you get really sick. I mean really sick. You will probably end up in the emergency room because you'll be vomiting and so nauseous that you'll need medical care. But the nice thing about this medicine is that it helps restore trust in relationships. There's no sneaking drinks when you're taking Antabuse because your spouse or family member or friend can see you take it each day, and then you both know that for that day you're sober. Because if you're not, it'll be very, very obvious. So what if you're one of those guys for whom complete sobriety just isn't an option? You want to continue drinking, but think you need to maybe cut it back a little bit. Well, in that case, examine your relationship with alcohol. Are you experiencing some of the physical symptoms that I described earlier in the video? If so, you probably need to cut back. Are you using it just to mask another mental health problem? If so, maybe you want to get help for that and then cut back on the alcohol as well. Or what's it costing you in terms of your life at home, your life at work, and your overall happiness? Take a close look at it and determine for yourself what you want to prioritize.